So my name is Hannah Guan. I am currently a urologist in the US. I'm a urology fellow working with Dr. Carrion right now at USF in Tampa. And after I graduate, I'll be taking a position as an assistant professor at University of Maryland. I always knew I wanted to go into surgery, and I think the first part was figuring out what kind of surgery I liked. So I looked a lot when I was in medical school. I looked at ENT, I looked at general surgery, and I did a 2-week rotation on urology, where I feel like I love the surgeries, the breadth of urology, all the different types of surgeries they had. And I really got along very well with the residents at the time. And so that's what convinced me to go into urology. Yeah, actually in my residency, I did not have a lot of experience with male sexual health or penile implants. I had a few cases that I really enjoyed and I really liked it, and I actually sought more cases out at Hopkins, which was across the street from my residency. And the more cases I did, I just really liked working with the patients. I like that they came in with a problem and the surgery that we did was essentially like a fix, and they were very happy afterwards and they really like that. So I liked that you saw them before, you could fix their problem, and then afterwards you would get feedback from the patients about how well they were doing. I think there are a lot of patients out there who could use the surgery and who are not looking for the surgery because either they don't know about it or their urologists don't offer it or family doctors are not telling them about it. And I think it's a great surgery. It restores a big quality of life aspect back to them, and it lasts a long time. I think patients are very happy afterwards. I think the satisfaction is super high after surgery. So I think after they've exhausted the other options, I think it's a great option. I first learned about Dr. Park in residency. Actually, we were doing a journal club on male sexual medicine, and he wrote this paper about how he does subcoronal IPPs and how he does not have glans necrosis. And we were reading, I think I was at PGY 1 or 2 very early on in my residency. And the line that stuck out to everyone in my residency was that he does these cases under local. And then eventually when I went into my fellowship, I learned a lot from Dr. Carrion. I've met a lot of people at the AUA. And then ultimately when I applied for this scholarship with the Wilson Foundation is really when I learned a lot about Dr. Park. I think the surgery went great. It's not a typically approach that I typically see, so I think it's great to learn other approaches, to see how clearly an expert is doing these procedures. And really I've been taking crazy notes on how to take home to see if we can recreate this as well. And I think it's a very innovative approach that I would love to incorporate also in the future. Well, I think he's a great surgeon. Working with him or observing him today, clearly he's very, very talented. And also he's a great mentor, I think. Again, I've just met him, but he's very warm, he's very welcoming, he's very friendly. And he seems very interested in teaching, me and just younger urologists who are coming in the field. And he seems very collaborative. And I'm very excited to get to know him better and to have him as a colleague, but also as a mentor moving forward. How much time do you have? So I have always heard about Dr. Wilson from the prosthetic urologists that I've worked with at University of Maryland, at Hopkins. I've read a lot of papers that he has published, that he's been involved in. I mean, the history of penile prosthetics, it's hard to talk about the history without talking about Dr. Wilson. So I think in terms of being immersed in prosthetic urology is really how I learned about him. And he's obviously a very phenomenal, amazing surgeon, and I'm very honored to have the opportunity to really meet with him and have a lecture by him. I've never had that before, so it's really an honor to be here. Yeah, absolutely. I think the scholarship was an amazing opportunity. Like I mentioned, I'm very grateful to have this opportunity. I don't think that I would have otherwise been able to come here to learn from Dr. Park. Other than just like learning surgery, I think a big part of the scholarship is setting up a practice, what to present to patients, patient counseling and things like that, which is a huge part of being a prosthetic urologist. So I felt that in particular was very, very helpful as someone who's currently a fellow who has not yet started a practice. That was very educational. It's going to be very helpful, I know. So I've definitely taken a lot of notes. So I will be going into an academic practice, which is also one of the reasons why I find it really important to see everything that's out there, because I think in academics, I would say, I think we're a tertiary referral center. So I want to be able to offer patients, all the modalities, all the options. So for my practice, I want to do primarily penile prosthetics with some prosthetics in terms of like incontinence as well. But I really want to focus it on men's sexual health. I would say thank you to Dr. Wilson and Mrs. Wilson and the Wilson Educational Fund for sponsoring me on this trip. It's truly, like I have told him himself, like a once in a lifetime trip. I find it super helpful. I think it's going to be an amazing way to start my career, and I'm very grateful for the opportunity.